All right, we have John Harwood back in Washington. He's got Representative Debbie Wasserman Schultz, a Florida Democrat. Hello, John.
Thanks, Larry. And we have Debbie Wasserman Schultz from Florida, one of the most influential House Democrats. Let me ask you this. We just heard Robert Reich, the former Clinton Labor Secretary, tell Larry a moment ago that the Obama speech leaned very much toward the Senate Finance Committee proposal rather than the House proposal. So as a House Democrat, did you hear anything that concerned you in the president's remarks?
No, on the contrary. I mean, I think throughout our caucus, the response to the president's speech was overwhelmingly positive. I spoke to conservatives and progressives after the speech, and all of them felt really good about it.
Even though the president said all those liberals and progressives need to calm down about the public option, and if it's not there, it's not a tragedy?
No, he didn't say that if it's not there, it's not a tragedy. What he stressed, which is the important point to note, whether it's leaning towards the Senate or leaning towards the House, is that our overall goal of providing security and stability to those who have insurance, covering the people who don't have insurance, and driving down costs, those are the three main principles. And if we reach that goal, how we get there shouldn't be as much of an issue.
I talked yesterday to former House Democratic Whip David Bonnier, who said everybody in the Democratic Party remembers 1994, what happened when we didn't act. That at the end of the day, House Democrats are going to fall in line with whatever comes out of conference. You're not going to have a rebellion if you have, say, a triggered public option as opposed to what you all come up with in the House. Is that correct? Liberals are going to vote for this bill in the end no matter what?
At the end of the day, we are absolutely fervently committed to making sure that we provide security and stability to people who have insurance so that the small business owners in America don't have to constantly wring their hands over whether they're going to be able to provide coverage or choose between coverage and layoffs, cover the 47 million Americans that don't have health insurance, and bring down costs. And I think one of the really good things that President Obama talked about in the speech tonight as far as bringing costs down is that he'd also ensure, with a provision in the bill, that we would engage in further spending cuts if the bill doesn't produce the savings. And that's going to bring our caucus together because there are disparate interests on both sides.
Will House Democrats be willing to throw overboard that millionaires surtax that you all voted in the committee process in the House in favor of this idea that the president endorsed tonight to have an excise tax on high-cost insurance plans?
I think that there is no shortage of good ideas, and I don't think that we have bought into or drawn a line in the sand on any one financing option. We're committed to making sure that the bill is paid for.
But
we
House
don't add
Democrats
to the
could
deficit.
give up that millionaire surtax in favor of what the president came out for tonight.
I think a higher priority for us is to ensure that the bill is paid for, that it doesn't add to the deficit, and that we stick to the three principles that the president so aptly laid out tonight.
Last question as a Florida Congresswoman, quickly. The president's been hemorrhaging support among senior citizens. How well did he do tonight in reassuring seniors who've been scared by those death panel stories and that sort of thing?
Well, I think he gave senior citizens the peace of mind that they needed, and I think, quite honestly, there's been a lot of hype around the angst that senior citizens have had.
He is proposing big Medicare cuts.
But those are cuts on the provider side, not to benefits, and we need to make sure that we incentivize hospitals to limit the readmissions that we have and take care of our senior citizens on the first go-around when they first enter the hospital, make sure that they leave as healthy as we can make them.
Congressman Debbie Wasserman Schultz, thanks so much for being with us.
You're welcome.
Easy for me to say. Larry, back to you.